hope that you'll all see the next 30 minutes as an opportunity to do just some kind of peer-to-peer teaching and learning. I'm going to play facilitator for the most part, along with Wendy and whoever else wants to help us with that. But just know that there's a lot of wisdom in this room. We got 30 or so really smart folks here, so we can teach one another. While you're thinking about inquiry points and questions, there were a couple of questions we did not get to in the first session. And one of those had to do with, well, how do you start this conversation between child welfare as the kind of the lead agency, if you will, in most jurisdictions and others? And we prepped a couple of slides for that. We didn't get to it. And I don't know, Wendy, if Wendy, can you screen share those 2 slides, or would you like me to try to do that?
We can try. Do you have the slides available right now?
I probably have them here. So let me see if I've got them. There they are.
Oh, nice.
So let's see if I can move this just enough to actually get to it. So if I were in a place, which is, I think, a typical place to be right now in terms of planning and trying to figure out, well, who are the partners and how are we going to have this conversation? And if I were looking at my existing system of care partnerships, some of the questions that might inspire an early planning process might be these. I've got 2 slides here, and we can would love to get your feedback about these and others, but certainly want to focus on how eventually our plan will affect disproportionality and equity. One of the foundational premises of FFPSA is to get to this long-standing problem, right, around disproportionality and the racial disequity that's in our systems. And so we got to have that conversation early on. Inherent in this work, as we've been talking about the last few weeks and this morning, how will we connect this new program opportunity, if you will, this initiative, to other prevention work? How are we going to do that? And it's going to be different in every county, right? Third question, how will we measure impact? So your plan, I think, has to have some articulation of how you're going to monitor outcomes. And while we may not as a state yet be super clear about what the expectation is going to be, you're going to want to, just from a practice standpoint, a leadership standpoint, you're going to want to know whether or not we're having any impact. And so thinking about, what are we going to look at? What are the matrices, the data points that we'll monitor, right? And I would start pretty early with this conversation, frankly, because in some cross-agency consideration about what impacts are we looking for, you'll then find alignment. You'll begin to see that, oh, our probation department has very similar goals that are similar to ours in child welfare and mental health, right? So, and same for schools. So just starting with that conversation around what data points are we going to look at to measure impact would be huge. And then, as we've talked about again a couple of times, do our fiscal managers know and understand each other? So that question is worded specifically that way because you heard Ventura talk about relationships, and we've been talking about, we'll be talking in 2 weeks about integrated core practice model, which is really foundational to the relationships between organizations, right? So professional leadership behavior and knowing and understanding are 2 different things, right? Like I can know who they are, but if I don't understand their world and I don't understand how they see their world, that's different. And so starting now with conversations between fiscal analysts, budget officers in different departments, they need to understand one another in ways that allow them to actually determine how they're going to share the revenue And it's twofold, right? The drivers here are twofold. One, there's an audit compliance concern, right? Because you don't want to get caught, doing something that you shouldn't do, mixing two federal dollars, for instance, or using a non-Fed source like twice to match, right? Like those are both big boo-boos. So the analysis that's required for this is significant. And so starting early with this, getting folks into relationship is the critical factor. They don't have to have solutions right away. But if I were in county land, I would probably be encouraging, supporting, convening interdepartmental, multi-agency, cross-agency fiscal conversations specific to my CPP process. So almost like a subcommittee of my CPP. And just start with like putting in a matrix, like all of your prevention funding allocations, like what are they? You go to the Behavioral Health Authority and there are 4 or 5 or 6. You start with the Medi-Cal, right? You got MHSA, you put like, what are all of our prevention funding mechanisms in behavioral health? Same with welfare, same with probation, same with your county office of education or your big SELPAs, right? And that's going to be a long list. It's going to have 10, 12, 15, maybe 30 in some big counties. And just start with that functional inventory of what are our prevention dollars now. Just doing that alone will begin to highlight for you where you'll begin to kind of choose from a menu of what your funding streams will be going forward. So these are 4 questions. Let me pause there and take any reflection. I can't see chat for some reason at the moment.
I can read the chat too, Richard, if you need it. The only thing I want to add is that these slides have been made into a handout, and I will drop the link in. So if you're trying to take notes, you're going to have this in a handout. I will drop that into the chat.
Wendy,
and Richard, if any questions come up in there. Well, and first of all, we're a pretty small group, so you can also raise your hand or just jump in. This half hour of office hours really is for a dialogue. So feel free to jump in, raise your hand.
Please do come off mute and just chat with us. All right.
Well,
yeah.
I'm happy to take a stab at this, even though I know, all counties are kind of, we're all kind of different and the same, and we all know this, how it works. But I don't see for the CPP coordinated services, I don't see how it can't not impact disproportionality and equity issues, because I think that from the get-go, the lens that we all have to take in the planning. So just from the internal planning that's happening right now to and I kind of want to make my comments broad, so I'm not talking just about Sacramento, but I think, when I read that, I think that for folks that are really understanding the goals within child welfare overall, I really don't see how it can't. That's going to require, as we know, some focus on really assessing your jurisdiction and really having those kind of what I just call those honest conversations about what exists now, what is your data showing you right now, what exists in your community now, and where you're doing well and where you're not. And so I've talked with just some of my internal team. We've got a variety of folks across our department working, but specifically what we're doing in child welfare right now with my management team that will help inform the FFPS planning is we're really looking at all of our regions and we have our overall Sacramento County data, but we're now starting to do regional dashboards. And what those regional dashboards are going to help inform, it's not just compliance, but there's a segment to these that we're starting the work on where from those dashboards, there's definitely compliance that are part of those dashboards. But the other part that I'm just as excited about is who are the kids in the regions within Sacramento that we're serving. And then what I told my team is I want to do a comparison to, in those regions, what do we already have in existence for services for those we serve? And how it's that same thing. It goes back to how far are people traveling for a certain service? Do we see what's called non-compliance in a certain region, but is that necessarily, which historically has been looked at from a child and families non-compliance, or is it that we're not meeting that need? So I just want to share that little snippet about looking deeper into the overall county data, so that, you can say, here's our, we know our federal outcomes and how we're doing, but it's been pretty interesting thus far as we've broken down by region.
Melissa, I love that. Can we go a little bit deeper on that? Can you talk about like what one or two examples of what data points within that conversation you're talking about, like in your regions, what are they first looking at?
So we're definitely looking at, like, from a compliance measure, we're looking at, like, what do people's face-to-faces look like? What is court report timeliness? All of those kind of what I call the compliance data. And then what we're doing is we're pulling the demographics. So in the North region, how it's set up in Sacramento, in the North region, in, say, the permanency program, who are the folks that permanency is serving in the North region? And you look at those numbers, and who are the folks, who are the people being served by emergency response teams in the North region? And then for what we expect from kids and families, are we appropriately, do we have appropriate expectations? Are we asking them to travel far? Are we taking into account what community services are or are not there that we can connect them to? And then from there, and this is, we're not here yet, how can we work with our community to say, hey, we realize we're working with a number of Eastern European families in this particular area, but we find that they're going 30-minute drive to get connected to a community service that they're comfortable with, that has, services available in the languages that they speak. And talk with those community providers about what could it look like for you to open up the community services that exist in Rancho Cordova in the east part of the county over in the north part of the county, and how might Sacramento County assist with that?
Got it. Thank you.
So
love it.
Very early stages, but I'm very excited about it because it's also kind of reignited. And Diana's on here. She's on our executive management team, Diane McFarland. But I have really felt, but I do always try and get the voice of my team. I have really felt, just by affect and verbal response, that it's kind of reignited some energy into our team and some connection. But I would defer to Diane on that because, I typically see things glass half full.
Right on.
So, Richard, I don't see any other questions, but we do have questions that came in from the learning forum and in between. So I'm going to ask you those. And then if anyone else wants to jump in with a question or the chat, I'll keep an eye on that too.
Sure. I do think, Wendy, we do have Tony Rosansky, who commented about the business development aspect being critical. I wonder, Tony, could we invite you to just elaborate a little bit on that for us with your kind of multi-state perspective here for a second?
Oh, sure. I don't know that I can speak with much expertise other than the highlight of that is needed. And I think across the nation, what we're finding is child welfare jurisdictions are really ill prepared to be at the table of business development. That's not the business we do. And so where through the county, like your economic development shops or whatever the case may be, the appropriate departments, that's a place to lean on our peers to say, like, we need something that is different. We don't know how to do this, and we're not very good at doing that, I think, in child welfare, but just like we're doing different to serve kids and families, I think this business development aspect of getting the services closer to home for kids and families is critically important.
Yeah, I love that. And I think the community-based organizations amongst us would celebrate this, right? Like, because they do business development better than we do in government typically, right? They've got to have a plan for their board of directors that says this is how we're going to grow our business. So yeah, fantastic, good stuff. Okay, Wendy, give us one of those questions then left over.
Okay, so are there any suggestions about how to integrate the parents' youth with lived experience appropriately into the ILT group? And then there's a little follow-up to that. And it says, the ILT group often speaks about other families as part of the systems of care work. Yeah. And so we wouldn't want the parent, youth privy to some of that confidential information.
Yeah. I can tell you about some of the models I'm familiar with. One or two of those I've helped to build, but we also have both Santa Clara and Sacramento in our conversation this morning. And maybe if folks are willing, you can comment about the way you're approaching connecting the voices of lived expertise into your either your system of care work or your prevention work. While you're thinking about that, I'm looking at Wendy, Melissa, Abby, someone else from your two counties. But let me just tell you that in Placer, the model, longstanding 30-year-old system of care, right? What they have had in place for decades is the interagency leadership team, which is known as SMART Policy. They meet twice a month at 7:30 on a Wednesday morning. It's chaired by the presiding bench officer. It's a very intense hour-long meeting, and it's an intensive model twice a month, right, for an hour. We have two nonprofit organizations that are in Placer a foundational part of the system of care. They're co-located with county staff in our buildings. They're just standalone CBOs on paper. And so each of those agencies has an executive director, and the executive director or program manager, in the case of the youth, they attend the ILT every single time they're there. And they're not voting members, right? They're not signatories, but they are there, and the signatories look to them for guidance and feedback and perspective all the time. In fact, the judge often will look first to our parent partner exec and say, hey, Christy, what do you think? Same with our youth. So while it's not formalized in your MOU under Assembly Bill 2083, you can formalize it loosely there. The second level in Placer historically is there's an executive advisory committee to the SMART Policy Board. So right underneath the ILT, there's some senior managers that meet every single month for a couple of hours, and they plan stuff, right? They execute the vision of the system of care, if you will. And there are additional parent and youth perspectives, representatives there routinely. And they are, you can imagine, after 30 years, they're well trained, right? This is a sustainable model. So they have grown up in the system, and they can step in and jump into a work group here or an ad hoc conversation there with relative dexterity and agility. Those are the ones I see most often. I don't know, either Melissa or Abby or Wendy, you want to talk about Sacramento or Santa Clara? And then I do see a hand from Kiki. Wendy, any thoughts?
Sure, yeah, I can weigh in just a little bit. So this is an area we are grappling with in Santa Clara County and want to step up and commit to how we ensure that lived voice and co-creation, both from a youth, a parent, and a caregiver's perspective as well, knowing that we really want that push for relative and non-relative extended caregivers at the table. So 2 strategies that we're looking at right now. One is putting dollars into stipends whenever we ask someone with lived experience to come to the table, whether that be a focus group, whether that be a contextual interview, whether that be slots sitting in a group that we go to advise or check in or to fill out a survey and those type of things, and having that be a consistent amount across the realm in what's provided for them, as well as we're trying to go further and connecting with our partners in other spheres and how they provide stipends as well, so we can try as a county to move closer to having some consistency around that. Then the second piece we're trying to do around our AB2083 and integrated systems of care is to create lived experience positions that are, as Richard said, not on our possibly signatory lines, but are an active member and a key part of that process, both from a youth perspective and a parent's perspective. What we're grappling with now is that we oftentimes know that there's an infrastructure needed to do that. Things will come up for youth and parents that might not come up for myself at the table. And so we need to make sure to support that. So we will probably go with a model where we're connecting with our other partners to have those positions up underneath that umbrella so they have the additional support. So that is what we're on right now. I can bring back to this group and to my partners from other counties. We're hoping to have something finalized by the end of September, so I'd be happy to share as we're grappling with this.
Thanks, Wendy. And then really quick from Abby, and then we'll go to Kiki's question.
Sure. So we're doing similar work here in Sacramento County. We have parent partners sitting on our prevention cabinet currently. We have 3 of them. They have lived experience. They've applied through a process, and we're looking to add more. And so they're really informing our strategic plan, our child abuse prevention strategic plan. And we're looking to, we're also providing stipends to honor their time, working with us through the prevention cabinet and through our interagency leadership team. We had discussed doing the same model with, but including our parent and youth voice in our advisory team, which is kind of like the workhorse of our system of care. And so they would, really be able to give meaningful input as we begin to, develop the building blocks and implement system of care across our county. We haven't quite gotten there yet, but that's where we're heading here in Sacramento County. We also are talking about in the future, looking to gather groups of parents to inform us that, for different specific projects, think tanks and all of that, and also utilizing our local citizen advisory committees that have parents and people with lived experience sitting on those as well. So really just have different strategies that we're looking to implement here.
Abby, thanks. Wendy, appreciate that. My follow-up to that really quickly is when we recruit parents and youth with lived experience, it's often important to do so in teams or groups, right? Because hiring one person with lived experience and sticking them in a public system is overwhelming, right? Like it's very difficult to do, but bringing on 2 or more at the same time, co-locating them, cross-training them, right? Like supporting them as a team, they're much more likely to sustain themselves, right? So think about that. Kiki, good morning.
Thank you. Good morning. So I am from Contra Costa County Probation, and just all this talk about governance and ILT brought to mind, some, I don't know if I can call it a concern. That might be a strong word, but I'd mentioned recently in our CPP steering committee meeting, that obviously placement for eons has been a small island of probation, right? And so what I'm noticing is here we have our admin ILT team for 2083, which I'm a member of, and then we have our exec level, which is the chiefs, the directors, I'm sure like most counties. So I am typically the probation person at not only the admin ILT, but many of the other foster care related meetings, whereas my partners over in child welfare, the face could vary. So I'm just wondering if anybody else is, or has any comments or any insight on this kind of thing. Obviously, we're all very strapped for time, so I'm always trying to use the many meetings that we have more effectively. I'm even in the midst of doing a meeting matrix for all of the agencies that are a part of the ILT, because one, for me, quite selfishly, as I mentioned, it's usually me that's in all these different meetings from probation, but also I'm concerned about the disconnects that may be occurring for the partnering agencies, because there's a different person, a different administrator for child welfare, or not really behavioral health, because she's a bit more strapped for time too, which is a whole nother issue of having the 1 foot in and 1 foot out of the meeting, right? So we don't feel very effective. So I'm just, I guess, I don't even know if there's a question here, except does anybody have any insight, or feel free to also commiserate with me if you want, but do you have any thoughts on, how to just really take that first step to make sure that we're connected, in this effort, because there's so many things going on at once. And as a probation person, I'm like an octopus over here with my hands in all these things, but other agencies have more resources, which in turn also means you have way more people involved, and the information may not be as, equitably shared as it's coming from me as the one person on my end. Hopefully that makes some sense.
Yeah, we got just a couple of minutes left, but any quick reflections for Kiki about that? I know from some of my county work that, probation folks have so much work going on, and the human capital resources are not as pervasive as they are in welfare typically. So, my only suggestion, Kiki, is just be sure their meetings are well supported, that you've got an admin person with some minutes, right? Because if the person can't be in the meeting, or if you need to connect some of your people to this process, using those minutes sometimes it's a cheap substitute, right, for investing in an hour that you don't have on your calendar. But real empathy for you for acknowledging that the lift is heavy. I wanted to acknowledge really quickly in chat, yes, there's a role for the courts. The most successful systems of care that I've seen always have the bench officer involved. There's something unique about the robe being the figurehead for that conversation. And the judicial code, section 5, subsection 20, if your judge is resistant and says, I can't do that, it's not ethical for me to be part of this conversation, pull out code 5.20 judicial code, because the presiding bench officer is encouraged, supported by code to be a part of your ILT. Thank you, Janet in Tulare, for a good suggestion on involving lived experience through your PSC engagement. Thanks for that. I saw a hand from Rocio Abundis in Santa Clara. Got 1 minute, Rocio.
It's just a slight digression about the community engagement. Just one thing that I think is really important, I think Sacramento was alluding to it, is the onboarding of our community members. It's really difficult to bring just anyone from the outside in, but a community member in particular, they're not going to understand our jargon, our acronyms, our lingo. And so we're creating a very simplified PowerPoint. I have several people helping me with it, and it's really difficult to bring it down to a level that they're going to be able to understand without our lingo in it. So we'll be doing an onboarding orientation for the first group of people that we identify, and then we're going to record that as new members come in, that they can then watch this so that they can kind of familiarize themselves. I think the idea of teaming 2 people at a time is great, and then also somebody being able to be a guide by the side with those community members to help them understand, what is being said and what role they can play, I think is more important than anything. So I just wanted to add that tidbit.
Love that. Abby, 10 seconds.
Okay, Rocio, we're doing the same thing here. So I don't know if you want to connect offline, but we've already developed some onboarding for our.
Oh, perfect.
And we actually have assigned prevention cabinet partners to go alongside with our community reps. So we stay connected. I'm one of them actually. Okay. And like if they have questions about the meeting or whatever, we talk offline and all of that. So it's a great idea, and it's something that we're doing. So if you want to connect on that, we can.
Excellent. I just need your contact
info. I'll put it in the chat.
Thank you. I put mine in there. Thank you.
Okay.
This was amazing, everyone. Richard, thank you so much. There is, you can see the link for the next learning series, which is in a couple of weeks, and all of the questions that were discussed today and that were not answered live will be in the written document that'll come out on August 19th. And you'll have an evaluation or opportunity to ask questions on the next time you sign up. So there still is opportunity for asking more questions. And thank you all so much for participating. Thank you, Richard.
Thank you.